Okay, so today we're getting into something that I think is going to be really relevant for a lot of people out there. Um, we're talking about getting ready for surgery.
Oh, absolutely. A topic we can all relate to at some point in our lives.
Yeah, for sure. But we're going to kind of go a little bit deeper than the usual advice you might hear. Like we really want to focus on how to maximize your health both before and after you have surgery.
Right. It's not just about the day of, it's about the whole journey, isn't it?
Exactly. And to help us with this, we've got some really fantastic insights from an interview with Professor Jagdeep Dhesi.
Professor Dhesi. Oh, she's fantastic. A real leader in this field.
Oh, she is. And she specializes in geriatric care and really the whole idea of preparing for surgery. Now, I got to say, one of the stats that just blew my mind from her work
Yeah.
was,
What was that?
well, she mentioned that in the NHS, like something like 7,000 operations happen every single day.
Wow, that's a huge number, 7,000.
Yeah, it's just mind-boggling. But then what really made me think was that she also pointed out that about 10 to 15% of those patients actually end up facing some kind of complication.
Ooh, that's a bit of a wake-up call, isn't it? Makes you realize it's not as straightforward as it might seem.
Yeah, it really does. But here's the good news. Professor Deasy's research shows that we can actually do a lot to reduce those risks. Like, we have more control than we might think.
That's so empowering. It's not just about hoping for the best. There are things we can actively do.
Totally. And she talks about this idea of prehabilitation. Have you heard of that before?
Rehabilitation, yeah. I mean, it sounds a little bit like, what do they call it? Like a fitness boot camp, almost.
Yeah, I can see that.
But it's specifically, to get you ready for surgery, right? Like
Yeah.
thinking about what your body's going to go through and preparing for that stress.
It's like training for an athletic event, but the event is your own surgery. That's a cool way to think about it.
Right. And what's great about Professor Deasy's approach is she really emphasizes that it doesn't matter if you've got 2 weeks before surgery or if you're looking at 18 weeks, any amount of time you can put towards this prehab idea can make a difference.
That's encouraging because sometimes it feels like, oh, if I haven't started months in advance, what's the point? But that's not the case here.
No, not at all. And she's got a great quote about this. She says, "You're going to be putting your body through stress, so you've got to be ready for that stress."
It's so straightforward, but it makes total sense. So let's break down how to actually do this. What are some of the concrete benefits we can expect from this prehab approach?
Well, I think one of the most important things, and Professor Deasy talks about this a lot, is exercise.
Okay, exercise. Yeah, that makes sense.
It's like, your surgery is the big game, right? And exercise is the training that gets you in shape to really perform well and recover.
That's a great analogy. But I'm curious, what specific improvements are we talking about? What does exercise actually do to prepare us for surgery?
Well, let's start with something really crucial. Your cardiorespiratory health. So your heart and lungs. Exercise makes them stronger, right? And that's incredibly important when you think about things like anesthesia and just the overall stress that your body goes through during surgery.
Right, because surgery is such a physical challenge. Your body's working overtime to heal.
Exactly. And if your heart and lungs are in good shape, they can deliver oxygen and all the good stuff to your tissues as they're repairing much more effectively.
That makes a lot of sense. So beyond the cardio aspect, what else does exercise help us with in terms of surgery prep?
Well, muscle strength, that's a big one. I mean, think about it. The stronger you are going into surgery, the easier it's going to be to regain your mobility and just, your independence afterwards. Especially for things like hip or knee replacements, this is crucial.
Yeah, I can imagine that makes a huge difference in those cases.
Oh, absolutely. And Professor Deasy's research has shown some really impressive results in that area, particularly with improving balance.
Oh, right, balance. I hadn't even thought about that.
Yeah, it's so important, especially if you're having, hip or knee surgery. Because if your balance is good, it massively reduces your risk of falling, which can be a big concern during recovery.
That's a really good point. I'm starting to see how personalized this prehab approach is. The type of exercise you do will really depend on your individual situation and the kind of surgery you're having, wouldn't it?
Yeah, absolutely. It's not one size fits all, which is what makes it so effective. Like if you're someone who, isn't super active right now, even just incorporating 10 minutes of walking a few times a day can be a great starting point.
That's reassuring. It makes it feel achievable, like I can find 10 minutes in my day.
Yeah, for sure. And then, if you're already pretty active, you can maybe look at some more intense workouts, something more tailored to your specific needs and the type of surgery you're having.
Yeah. Right. There are options for everyone. So we've talked a lot about the physical benefits, but Professor Dhesi also highlighted that prehab isn't just about the body. It can actually have a big impact on our mental and cognitive well-being, too.
Oh, absolutely. This is a really important point. Exercise, even moderate activity, has been shown to really boost your mood, reduce anxiety, and even help with cognitive function.
So it's really about preparing your mind as much as your body.
Exactly. And I love this quote from Professor Deasy. She said, "It's not just about the operation, it's about getting your health as good as possible after the operation for the long term and setting up these long-lasting habits."
It's about seeing surgery as a springboard to better overall health, not just a hurdle to overcome.
I love that. A springboard. That's
Yeah.
a great way to put it. And she also talks about this idea, have you heard this, the use it or lose it principle?
Yeah, I'm familiar with that, but I'd love to hear her take on it.
Well, she emphasizes that, the more we move and challenge our bodies, the better we can maintain our physical function, especially as we get older. And she had a really powerful example. She described a study where they looked at a group of older adults, and the ones who consistently walked, like just for 30 minutes a day, had significantly better hip joint health and, less risk of falling compared to those who weren't as active.
It's amazing how such a simple thing can have such a big impact.
Isn't it? It really highlights how crucial movement is, no matter how basic it might seem. And, here's something that really surprised me. Professor Deasy mentioned that sometimes being really proactive with prehab can actually, in some cases, eliminate the need for surgery altogether.
Wait, really? That's incredible.
I know, right? It's not going to happen for everyone, of course, but it just shows the power of, taking control of your health and really making those changes.
It's so inspiring. So, if we were to distill Professor Deasy's message down to its core, what would you say is the key takeaway for our listeners?
I think it's really about taking ownership of your health journey. It's not just passively accepting what happens. It's about actively preparing and finding what works for you.
That's such a powerful message. It's been fascinating to delve into this topic with you today. It's clear that being proactive with pre-surgery preparation can really make a world of difference in our outcomes, both physically and mentally.
Absolutely. It's about becoming an active participant in your healthcare, not just a passenger.
I love that analogy.
Yeah.
Well, as we wrap up today, I want to leave our listeners with something to think about. If you were facing surgery in the future, what's one small change, even just one, that you could make today to start preparing? Remember, it's those little steps that can add up to big results in the long run. So keep exploring this topic, stay curious, and we'll see you next time.